In Missouri test positive for coronavirus, leading to many concerns about what should be done with tight spaces that inmates live in. Our Carolyn Long is here now with more. Carolyn.
That's right, Ellen. This prisoner was being housed not far from us, actually, at a correctional center in St. Joe. We're told he was isolated in a negative airflow chamber 3 weeks ago with a respiratory illness before being transferred now to a Kansas City area hospital. That happened last Thursday. Now, this marks the first case of COVID-19 among the Missouri Department of Corrections offenders or staff members. But the executive director of the Midwest Innocence Project fears it's just a matter of time before we have more cases.
This is a population that's going to have to go to the hospitals to use the same set of ventilators that those of us out here will need to use. And we need to reduce that strain. And to reduce that strain means we need to put distance in between. We talk about social distancing. People cannot socially distance in prison. It is not possible.
Tricia Bushnell's suggestion is that Missouri follow the lead of other states like New Jersey to release those inmates who are set to be released in the next few months anyway.
I think it's incredibly disturbing and distressing, and we need to know what is the plan to get people who shouldn't necessarily be in prison out. Prisons are incubators for disease, for something like this. This is something where you have folks living, two people right next to a toilet, right next to their little sink together. And the ability of a virus to spread in that kind of setting is so much higher than anywhere else.
So now I have reached out to the Missouri Department of Corrections. They have changed their protocol to no longer allow visitations. They hold parole hearings via video conferencing, and they have suspended all transfers among prisons, though for now there is no plan to reduce inmate population in Missouri. Back to you.